Hello and welcome to the third episode of COVID Shots, a Foster Feed series of 4 episodes concerning the second wave of COVID-19 pandemic. In today's episode, we will be learning all about the diagnosis of corona infection from our very respected professor, Dr. Abhishek Ghosh sir.
Welcome back, sir. So, what are the measures that need to be taken if one suspects that he might be having COVID infection or he has come in contact with someone who is infected?
After contacting any suspected COVID patients, the patients tend to go for the RT-PCR test or COVID detection test just day after that. But you have to remember that incubation period is 5 to 14 days. So often symptoms can appear late. So if unless symptoms appear, we should not do or jump into the testing, because often after second day test, when patient is doing testing, not patient but the suspected contact who are testing on the second day after contact, then the RT-PCR test come negative, but symptoms may appear later and on the seventh or eighth day. And patients tend to avoid the RT-PCR test again because they are telling that my RT-PCR is negative, but that may be the false negative, because of infection of RT-PCR test positivity often comes after 5 to 7 days. So we should avoid at least for the symptom onset, or at least for 5 to 7 days before going to test. And if you have having symptoms, of course you take adequate hydration and maybe paracetamol. And if symptoms are RT-PCR test or rapid antigen test is confirmed, then we can take some medicines like ivermectin or doxycycline to reduce the viral load. But of course, that should be done with the physician consultation, because all doxycycline or ivermectin, especially doxycycline, that cannot be given in all patients. There are some contraindication of doxycycline.
And so, what are the diagnostic tests available as of now?
So diagnostic test available, mostly we do two kinds of tests. One is antigen test, and one is with rapid antigen test and RT-PCR. Rapid antigen test means rapid diagnostic test detect the presence of the viral proteins expressed by the COVID coronavirus, a COVID-19 virus, in a sample from the respiratory tract of a person. So if the target antigen is present in a sufficient concentration in the sample, it will bind to specific antibody fixed to a paper strip enclosed in a plastic casing and generate a visually detectable signal, typically within 30 minutes. And another test is RT-PCR test, which is actually confirmatory. So RT-PCR test, actually, that is a reverse transcriptase enzyme is that, as it is the RNA virus. So RT-PCR means they in this process they are generating DNA from the RNA, and their DNA is replicating. And as the PCR process produces multiple copies of DNA, then the analyzer can easily detect the DNA of the virus, and thus we can detect confirm the case. And there is a term called CT value in RT-PCR test. So CT value means cycling threshold. The number of these cycles, or number of these cycles that the DNA need to replicate before a signal change appears in the analyzer, that is actually called cycling threshold. That means number of cycles. Suppose in one patient the DNA cycle goes through 15 cycles, and then there is a change in the analyzer, signal change in the analyzer, then CT value is 15. And if a patient's DNA need approx 25 cycles to reach its adequate value to change the signal, then CT value is 25. That means for the 15 the viral load is high, because that needs less replication to change to be detected. And if CT value means 25, means the virus took actually the RT-PCR took much time to detect the signal change. That means CT value, less the CT value, less the more severe is the more higher is the viral load. But that doesn't mean that CT value less means always more severe infection. CT value more means always less infection. So that need to be correlated clinically. But CT value is the important marker to detect the viral load. So CT value above 35 means infection is So CT value above 35 means infection is negative. Because 35 after 35 cycles, if gene is not detectable, then we call it a negative. And CT value less than 20 is considered as high severe infection. 20 to 30 is moderate infection, and between 30 to 35 it is mild infection, and above 35 it is not. We call them non-infected.
And so, what is the significance of immunoglobulins IgM and IgG in COVID infection?
So actually IgG, IgM are only helpful in detecting whether you have previously been infected with COVID. They are not useful in the acute setting. Previous in 2020, many patients have done this IgG, IgM test, and physicians are also confused that what is the role, because in acute infection, even if your IgG, IgM is positive negative, then you can have RT-PCR test positive. So when you have symptoms, because antibody tests are, the reports come early, but actually that is not helpful in the acute setting. That is giving you a false protection. If you're even if your antigen antibody is positive, IgG, IgM antibody positive, it is not like that you are not getting the COVID infection. And that antibody positive means if you have contacted COVID infection early, an antibody is still present, but whether that is going to protect you or not, that is not sure. And if you are negative antigen antibody, then you have not contracted COVID infection, and you may contact COVID infection anytime. So actually, antigen antibody test is not needed. That is only maybe a purpose of research thing. That is not going to make our clinical decision by any means.
Okay, sir. And so, what are the immediate measures that one should follow if he is tested positive?
Yes. So immediate measures means if you are having symptoms like very high grade fever and frequent oxygen saturation is less. Previously, in previous year, we thought that oxygen saturation was 93% or less is alarming, but this year they have the threshold is higher. So that means oxygen saturation below 95% is called is advised to get admitted in hospital. Though the hospital admission bed is not available always, but I think one should try to get admitted as early as possible, because oxygen cylinder at home, that is not very scientific measure, because often during that acute situation, apart from oxygen, we need some other measures also. Maybe some in early part of the infection, we need may need some injectional steroids. We may need some injectional antiviral like remdesivir. That can be done in the hospital setting. That is not possible in oxygen. Also, what that misconception is that if I have oxygen at home, then I can run it in very high rate to get rid of this hypoxemia. But actually, unless we use proper device to deliver the oxygen, that is not going to help you. The nasal prongs, that we cannot use a high flow oxygen, so that is actually wasted. So if we want to use high volume oxygen, we have to use at least face mask, or even if that in hospital setting, high flow nasal oxygen is there, which can deliver oxygen at the 60 liter per minute. That is not possible in the home setting. In home setting, only mild hypoxia can be managed, but when there is severe hypoxia, patient must get admitted in the at earliest to get to have some additional support apart from oxygen, which is cannot be arranged at home. And of course, if a patient is having not so important symptoms, patient can tolerate the fever and there is mild cough, patient can take advice from their physician, and no need to consult at their chamber. They can do the online consultation is also available now, and as per the physician advice, they can take some drugs like doxycycline, ivermectin, maybe in mild symptoms. Some have uses not mildly but moderate symptoms with some cough which is not responding, which is causing some respiratory distress. Not oxygen saturation is normal, but respiratory distress occurs. There is some role of the corticosteroid like dexamethasone, and of course we have to take paracetamol. And just take basic supplements like vitamin C, vitamin D, zinc, etc. Not boost with multiple options, because number of drug is also already very high, so compliance is an issue. If we have to follow the important drugs mostly, not the vitamins, which vitamins will recover you, but not
Sure,
if your immunity is already good, then it is not so much helpful to your basic practice hand hygiene and proper nutrition, that is going to help you better than the vitamin supplements.
thank you so much, sir.
I hope you found today's video helpful. Please share it as much as you can for public awareness. Also, do not forget to subscribe to Foster Feed and hit the notification bell so that you do not miss the last episode of COVID Shots, which is coming up next Wednesday. Until then,